Even with everything that we had done to protect ourselves and our family, we still ended up suffering the most severe consequence of this preventable disease.
It's a flu campaign that started after one mother's unbearable loss, and to this day it continues, so no other family will know the pain of losing a loved one to the flu. As some pharmacies across Ontario are struggling to keep up with the unprecedented demand for the vaccine in what the province is calling their biggest flu vaccine campaign in history. Thousands of Canadians die of the flu each year. One of them was Jude in 2016, a toddler, a twin, and the reason why For Jude For Everyone exists.
Because Jude had failed to develop immunity from his own flu shot, when he was exposed, he was unprotected. So if we had seen more flu prevention within our community, then there wouldn't be so much community spread, and the flu may never have reached him and he would still be here.
Experts warn of a twindemic, COVID-19 and the seasonal flu coinciding, the potential to put a burden on a healthcare system, especially as parts of the country experience a second wave. And Jill Promoli's mission is to make sure everyone is vaccinated and protected.
The flu shot is for everyone, and not just high-risk people, everyone who's around high-risk people.
But like others, Jill had a hard time getting the vaccine as demand surged. This year, Ontario ordered 5.1 million flu shots, 700,000 more than last year. And as of the 22nd, over 4 million doses have been distributed to public health units. That's over 1.2 million more than the same time period last year.
We're seeing numbers initially in October that we've never seen before.
Pharmacies are feeling that pressure, with the Ontario Pharmacists Association saying they're seeing more patients than ever before. And the pre-COVID 20% flu dose allotment that goes to this group isn't cutting it. Some providers are getting over 200 patients a day, but in most cases they are only limited to 40 daily doses of the vaccine, which means people are being turned away.
The patients themselves are bouncing around in the system to try to find a suitable option to get a flu shot. They're potentially exposing themselves for risk in community spread of COVID-19 as they go to different places.
The OPA also wants the province to lower the age of who can get vaccinated at pharmacies from 5 to 2 years old, saying changing this regulation will make it more convenient and accessible for families with young kids.
We know pharmacists are comfortable. We have developed training for them that includes 2 and up. So I think that would be a natural way to ensure that more people get vaccinated.
And for the first time this year, pharmacists are also leaving their clinics to administer this vaccine out in the community, including for first responders. Now, given this demand this year, I asked the province if they're considering purchasing more flu shots. The province would only say they will explore purchasing additional doses as required. In Toronto, I'm Faiza Amin for City News.